And all of us are also well aware of the collateral damage of lockdown. There was a migrant crisis and so on and so forth. And compounding to that is the collateral damage of the non-COVID patients, or patients suffering from other medical problems who are not able to get timely medical attention. And the death and the sufferings of those patients are also considerable. And there has been some degree of fear, the COVID fear, and some of which had to do with what they are hearing in the news, the daily death being reported. So, has there been an excessive phobia or fear as far as COVID is concerned, either because of the way media has handled it, or in general because of our lack of knowledge of how these things are going to progress? And because of the excessive fear, is that why people are not coming to the hospital? And the collateral damage of the non-COVID uh, damage, particularly in Kerala, is probably even higher than the rest of the places, because the mortality rate in Kerala is probably lowest in the world at less than 0.3%, I think. And probably the non-COVID mortality in Kerala is much higher, and we don't even have any counts of that. So, is there been an excessive scare about COVID, which has caused these collateral damage?
So, if you look at the history of diseases, you will get part of the answer. For example, for diseases that cause death, people will have naturally there will be stigma in the community. So, TB is completely curable, but no, it was attached to deaths and suffering until recently, very recently. That's why still now, when somebody gets TB, people don't want to reveal that they have TB. HIV. When HIV started, it was linked to sexual route and those kind of things, and it was linked to morality. So people tried to hide the disease. So we did not get enough people to even get tested. So again, in this particular case, it is rapidly spreading and it is causing deaths. Even though death rates are less, in terms of it, if you consider the percentage, it is small, maybe 2 or 3%. But in terms of numbers, because it's a rapidly spreading disease, large numbers of people are dying. So all these add to the stigma, or the stigma in the community. But what happens is it's a very difficult balance. So if media doesn't cover it, people will not become aware. If media covers a lot, people will get scared. So it's a very difficult balance. And I think in Kerala, especially in Kerala, the media did a good job. So media was spending enough time to spread messages about the disease. They are doing, or they are telecasting or broadcasting government messages, as well as they are also creating their own messages and using the people. But something that is lacking, especially in Kerala, to some extent it's happening in India also, is a communication strategy. Now what happens is, different ministers will be talking different things. They don't have a strategy. These are the messages. Of course, there are messages, but there are people giving conflicting messages about the disease also. So that's happening. So if there is a communication strategy, whether it is an NGO, government, or a politician, everyone should be. And for that, you need a consultation. Strategy cannot be done just by the government or ministers. For that, you need opposition parties, NGOs, hospitals, government, private. We are lacking that. That's why everyone has to, even for this program, we don't have a reference document. We are trying to base on WHO or ICMR, but the state doesn't have a community. To my knowledge, there is nothing. So that's something that we are missing.
So we were talking about the case fatality rate, or the number of people who die because of the disease. So as I was saying, Kerala has actually one of the best numbers in the world. It's less than 0.3% or so. When it comes to India, it is at 2%, which is still low, because world over average is around 4 to 5%. So is there a difference here? Why is the death rate in India, and particularly in Kerala, much less than the rest of the places? Does it have to do with some degree of under-reporting, or all the deaths not being reported? Or do we have probably some pre-existing cross-immunity to COVID itself from the previous viral infections and so on?
So this is a very interesting area, because when it comes to India, everyone thought, no, we will be the worst hit country because of many reasons. Because of density, lack of awareness, so many things. And that was for the country. And when it comes to Kerala, we thought Kerala will have more deaths because we have more older population. Life expectancy is more, so this disease is affecting older people. So more people should die in Kerala also. So for two different reasons, we expected higher death rates for India as a country as well as Kerala as a state. We don't know the exact reasons. There could be multiple reasons. When it comes to the country, especially in northern states, of course, deaths will be recorded, but whether it is being recorded as COVID deaths, whether we have facilities for all those things, systems don't work in many northern states, states with very high population, like what's happening in India, in Kerala. I have gone to almost all North Indian states. I have seen PHCs not opening until 11 a.m., doctors not coming regularly, big PHCs managed by nurses, doctor has not come for last 2 years. These kind of issues are there. So I would suspect some of the data also. It's not deliberate, but missing. Data may be missing. So some of the deaths, that could be one of the reasons. There could be other reasons also. As a population, maybe we are different in reacting to, getting affected by the disease. So we don't know. Again, coming to Kerala, as we have a solid health system as well as we have people with better health awareness, and when people really become sick, they are taken care of by good doctors. All those things should also be contributing. But I would say, as a public health person, I wouldn't say that this is one reason or this reason number one or two are major reasons, because we don't have evidence. There will be studies in the coming months and years, and we will look at what's happening, and we may come up with reasons. One unfortunate thing, especially about Kerala, is that we have a lot of information, we are documenting everything, but we are not researching, we are not looking at our data, we are not trying to analyze. Government is busy with other things, but they are not making it available for other researchers or private sector, which could have done a better job. So that's something which we are lacking in Kerala.
Coming to the concept of COVID hospitals. So to begin with, we had this concept of COVID hospitals where all COVIDs were exclusively treated at one or two, which is predominantly the government system, the general hospital or medical colleges and so on. With the cases increasing, is that system going to be saturated? How much do the private hospitals and the private health system in the state have to chip in? Because as you know, majority of healthcare in the state is delivered by the private sector. So is there adequate private-public collaboration, and should private hospitals come forward more and take a more proactive role? And in that circumstance, is there going to be too much spread of cases around, and that is going to worsen the situation?
People like us, many of us were right from beginning in our television shows and discussions, we were trying to emphasize the importance of engaging private sector. See, there are a couple of issues. It is not just the case of COVID alone. See, government, of course, has the control. They are the authority for healthcare or health system. What happens is that people are not going according to government thinking. See, look at whether it is India or Kerala state, last 70 to 80% of the people, they go to the private sector when they become sick. There are multiple reasons. So government failures are there where private may grow. Or there are issues that government cannot sort it out. For example, see, we have done some projects in Mumbai city. Entire people are going to private sector because they want to go for their jobs early morning. Early morning, no government hospital is open. They come back late. All government hospitals are closed. So people have only option. Here also Kerala, majority of people are working. Their convenient time would be early morning or late evening or weekends when the private hospitals are available. So private sector is a reality. But inherent thinking of the government with respect to the party, they think that private is bad. So that mindset is there everywhere, especially in India and in our state also. So private sector is for profit, they are bad. So look at the auto rickshaw, which is private. Taxi is private. Because Kerala government cannot provide government vehicles for small gullies and small roads. So, and even for bigger roads, we don't have enough number of KSRT buses. That's why there are private buses. So that's a reality. So preventing private sector or keeping away from private sector from when you deal with any, let it be transport or something else or health, it's not the right thing. Here also, government was reluctant to engage private sector, which was very obvious. Forget about government, forget about private sector. Government was not even engaging Indian Medical Association, which is the sole agency, which is the umbrella organization of all kinds of doctors, or Nurses Association. I didn't see any. People were discussing with, of course, politicians were discussing among themselves. They should have brought in Indian Medical Association, Nurses Association. They could have advised the government better. So private sector engagement, now government has started, but it is too late. And again, private sector, why should private sector think about public health, or they don't have that, it's not their responsibility. Theoretically we can say that they are also responsible, but that's not their daily job. Private sector cardiologist doing a cardiac intervention or whatever, he's concentrated on his patient. He should have a public health kind of outlook, all those things are there, but it's the government which has to say, oh, this patient, it's very costly, or it should be at this particular rate, or we will give you government insurance or health insurance. These kind of things are responsible to the government. So this is a complement. It has to work as like a complementary system. So private sector is not shying away from responsibility. I wouldn't say like that. Private sector design itself is for a different purpose. But when government takes initiative, private sector listens. For example, Kerala is the model state for TB public-private partnership, which started more than 20 years ago. Even including this hospital has a TB unit. You can get government medicines from private hospitals in Kerala. So private sector is willing, but there has to be trust also, mutual trust also. Private sector also doesn't trust government for different reasons. We are not going into those details, but I would say that it's already, we are late, and we should take serious efforts to bring private sector also. It should not be government dictating and policing the private sector. It will never work. All of us should be around this single table. And if Health Minister and Chief Minister are there, IMA President should be sitting next to him, and SSSO President should be sitting next to him. That's how you are considering, that's how you build partnerships. Partnership means everyone is equal. There is no boss and there is no servant. So that's what is lacking here. Everyone working together and deciding on policy and implementing, which is not happening here, even now.
To sum up, what would be a couple of key messages in terms of a health policy advisor, in terms of what we should be doing different or what we should be doing new going forward, given the criticality of the situation?
Whether it is state government or central government, they have to first believe that they cannot manage this problem alone. Government is having that control and regulation, but stakeholders are everywhere. So government should be there, private sector should be there, NGOs should be there, decision makers in other areas, people who can influence the government, everyone should be there. So it's not a government problem. People are not government or private. So it's a people's problem. So that's one reason. Second thing is that we should have a communication strategy. We don't have a vaccine, we don't have a medicine. So everything is based on how each person takes care of himself. We see ministers and responsible people in crowded places without mask, which is wrong. So we should be having a communication strategy which everyone is obeying. So these two are. Then there should be efforts to encourage research and discoveries and inventions of all kinds of equipment. So we are talking about, even now we are talking only about a particular mask produced by IIT or something like that. We should have used this opportunity. See, we talk about China. Many people are angry with China because they produced the disease. That's how they call it. No, they created the disease, sent to every country. Now what they are doing is even in India, irrespective of all other political happenings and all, We know that Chinese products are coming to India even now, to all. So we blame them for creating, or I have a different opinion about that, but that's how generally people think. China created this virus, but China is creating solutions also. So I really feel that India has better scope for using all our resources, intelligence and manpower for creating solutions for this disease also. There has to be, we hear about different vaccines, tests, and of course people are doing it, but which means investment. Whether it is state government or central government, they have to invest a lot into research and related areas, and especially to come up with solutions which will become again. See, we were actually sending hydroxychloroquine and all. That is still controversial. But there are other opportunities for coming up with diagnostic tools, vaccines, medicines. Things are happening, but I think all our focus should be on that instead of going after unscientific methods and yeah. So these three areas are my, I would say, focus.
Thank you. Thank you, sir, for some of those enlightening thoughts about probably the worst public health crisis we have faced in our lifetimes, and hope we will come out of it with the suggestions that you have in mind.
Yeah,
Thank you.